Hey, Dr. Johnson. Thank you for sending us Mary, who's experiencing a lot of calf pain right now as a result of an uptick in her training for the St. Jude Marathon that's coming up. As you know, she's experiencing a lot of short-term pain right now and is really having a difficult time bearing weight through that foot, and certainly is unable to achieve her long-term goal at this moment, which is training for that St. Jude Marathon. In evaluation of this patient, she has exquisite myofascial trigger points in her calves, and I believe that a very good intervention for this patient would be dry needling. And I wanted to speak for just a moment about the rationale for the use of dry needling. Why would we use it? What's occurring? And what the state of evidence is. And so if we talk about just broadly, why would we use dry needling? The purpose of dry needling is to improve pain modulation. So we get an alteration in pain. And through that alteration in pain, what we get is we get an improvement capacity to tolerate the real medicine, which is the physical therapy. But the question is in what ways does dry needling modulate pain? And it works at the local, it works at the spinal and the supraspinal levels. Within the local levels, what we get is we get a reduction in substance P. And substance P is associated with neuroinflammation. So its presence makes it so that the pain fibers send more easily. So getting rid of that is an important component. Not only that, but we get a reduction in CRPG, which is calcitonin-related gene peptide, CRGP. And this is associated again with increased facilitation of pain. So its presence is a bad thing, and dry needling has been shown to reduce this. Not only that, but we get some good stuff that occurs. We get beta endorphin release, which is fantastic. We get a regulation of acetylcholine. It's thought that when you get these taut bands of muscle, one of the reasons is because acetylcholine is being released at the motor end plate and causing the muscle to contract. And so by sticking a needle in it, it's been shown that you get a more normalization of acetylcholine in that, which reduces the amount of contraction that's occurring spontaneously within the muscles, which has reduction in pain with that. And so those are some of the means by which you get changes at the local level, not even talking about pH changes. And so you get a renormalization of local tissue pH, which facilitates reduced pain. Okay, within the spinal cord, what's occurring is that as you activate these pain fibers, what's occurring is within the spinal cord, it's that there's the activation of inhibitory interneurons that are occurring within the spinal cord. So by activating these inhibitory interneurons, you're getting pain reduction at the spinal cord, which is fantastic. And then also within the brain, you're getting changes. Imagining that we've got taut bands of muscle which are constantly sending pain to the brain. By reducing that intensity, what we're doing is we're reducing that input to the brain, and via that we're thought to have a reduction in inhibitory. We're supposed to get the onset of inhibitory pain mechanisms within the brain, and we get a reduction in central sensitivity that occurs within the brain due to these long-term things. Now, it should be known that this dry needling is not a standalone therapy, and certainly what occurs is that the thought is that there's a window of opportunity that's afforded us by doing the dry needling. That if the patient is so painful that they can't engage meaningfully in exercise, then the use of dry needling to reduce that pain allows the patient to engage meaningfully in exercise and thereby get the long-term benefits. In other words, dry needling itself does not cure anything, and it's not the end-all be-all when it comes to the treatment of myofascial trigger points, nor the reduction in pain, but it's a tool to use in order to get one's foot in the door so that we can do more meaningfully beneficial things for this patient, which is the actual physical therapy itself. So this is really what's occurring, and it's thought that these would be beneficial for the patient. Hopefully, Dr. Johnson, that answers your questions, and the research is still being updated right now. So if you have any further questions, let me know, but just know that a lot of this information comes from Butts et al., Cagney et al., and really as amongst others. So thank you, Dr. Johnson, for listening.